Are you struggling from spinal stenosis? You recently gotten the diagnosis? I'm Dr. Jake Giese, physical therapist and certified personal trainer. I help people that are struggling from back pain, usually chronic back pain, pain that radiates down your leg, pain that has maybe numbness and tingling associated with it. So if that's you and checks any of those boxes, or even if you just have a diagnosis of spinal stenosis, this video is for you. Before we get into the video, I do have a couple things that you may be interested in. I do have a free ebook. It is how to get rid of your back pain in 5 simple and easy steps, as well as I have other options for a one-on-one consultation with me called my free body diagnostic. And I do as well have paid programs if that's something you're interested. You can go ahead, check the comments in the description below, and all of that will be linked there for your reference. If you have sciatica, go ahead, check out the recent video I just made. I'll try to put it in the cards here. Otherwise, this video is all about spinal stenosis. What is it, and what do we need to do to get rid of it? So first, let's talk about what is spinal stenosis. If you do a quick Google search, you're going to find out that spinal stenosis is just the narrowing of your spinal area, either your spinal column or kind of around the transverse processes, that can sometimes cause a pinching of the nerve or some sort of occlusion of the spinal canal. Now, you'll also find that this is most likely due to arthritis, most likely also going to affect people that are over the age of 50 years old. So first, let's talk a little bit about the anatomy. At the end, I'll give you specific things that you can try to change your posture, your activities, so that you can be pain-free. Okay, so let's go through a brief anatomy lesson. So this is your spinal column. We have some of the lumbar vertebrae here. This is what the bumps that are sticking out of your back. Here are the discs. As you can see, there are nerves that are running out in between those vertebrae, kind of right around the discs. This is why if you have any sort of disc injury, you herniate a disc, or as you get older, we get degenerative disc disease where these discs kind of shrink. That can create a little bit more pressure on the nerves, and then you can get sciatic symptoms. So with stenosis though, if we are having arthritis of our joint, and usually it's going to be right here, the zygapophyseal joint. So if you're having any sort of arthritis in those areas, then the buildup around that area, so the bones can sometimes calcify, they can get bigger, and then you can get increased pressure around the nerve. Just like if you had arthritis, sometimes your knees would get bigger. Same thing with your spine. Okay, so now that you've seen the anatomy, you kind of know what the structures around there look like. Now we can talk about why we need to adjust our body position sometimes so that we reduce our nerve symptoms. So on an MRI, that's scary when you see spinal stenosis, a lot of arthritis there, degenerative disc disease, but in reality, these are normal processes that everyone has to some extent, and you may even see them in someone that is younger. They just don't know about it because they're not symptomatic. So in reality, that diagnosis of lumbar stenosis or degenerative disc disease may not actually be causing your pain, because most people on the street over the age of 50 would have that diagnosis if they were to take an MRI, but they don't need to because they don't have any pain. So the structure changes don't always relate to the pain. Let's get into how do you fix, or how do you kind of remedy lumbar stenosis and back pain related to this if you're having symptoms like back pain symptoms. So as we said when we were looking at the anatomy, we have the spinous processes and we have the nerves that are running in between them. If we theoretically bend forward, we're going to open up this space, giving you more room there. If we arch our back, we are narrowing the space that may already be narrowed, and it's going to create pain. That's why as we get older, extension usually does not feel very good. We don't spend a lot of time in this position, so that's also why, but bending backwards you're narrowing and you're kind of putting more pressure and you're maybe even kind of pushing those two joints together a little bit more than they're used to. So that can be painful. Now, if you flex forward, bend forward like so, you are creating more space in between. And if you had any pressure on the nerve, you're getting rid of it by bending forward. So this is why as you get older, you may see your grandma, someone you know, bending forward on a walker. Now, families all the time come to me and they say, this is really bad. We shouldn't be doing this. Yes and no. You shouldn't be doing this for the main reason as if you're leaning forward and you don't have to be, you may get back pain because you're leaning forward all the time and now your back muscles are having to fire constantly, and you may get back pain because of muscle tightness, not actually a joint change. So with that, then I would recommend that someone stand up. Now, if you have stenosis and you're getting arthritis in the back, then what bending forward does is it's just creating more space back there, and it's going to create less pinch on the nerve. And it usually feels good. You can either lean forward on something, lean forward on a shopping cart, lean forward on a walker or some device, something that can get you forward. Now, the other thing temporarily. Now, the other thing that we can do is we can do something called pelvic tilts. So instead of bending our top and like that and putting more strain on our low back, we can actually do the work from the bottom and without adjusting our upper spine. We can do it all from our pelvis, and there you do it by two ways. So this is called the anterior pelvic tilt. So I take my hands, make an L, put them on my hips. I do that by kind of putting them on my abdomen, sliding down until you hit the ridge. And they don't go down anymore. You're kind of hitting a shelf. Now your hands are on your hips. You can see that if I don't move my upper body or my legs, I can tip my pelvis forward. So if I just keep my hands where they are, this is me doing a pelvic tilt. So if I want to do an anterior or a forward tilt where I'm tipping forward, I just tip that forward down. And then if I want to do a posterior pelvic tilt and tip kind of the bottom under, I rotate and kind of squeeze my buttocks a little bit and then rotate underneath. So this is called a pelvic tilt. The reason I'm showing you this is you can do it in sitting, standing, lying down, and it's a really good tool. I use it on a lot of my patients that have acute spinal stenosis. They're having symptoms, or even sciatica. You can do this to help reduce your symptoms. So what you would do is you want to create more opening. So instead of bending forward, what you can do is do the posterior pelvic tilt. So you're kind of tucking your butt underneath and you're tipping your front up. So your fingertips should be kind of rolling upwards. And what you do is you're actually kind of like squeezing your butt cheeks together, almost feel like you're hip thrusting. So that's what it is. It kind of feels like you're hip thrusting. You can start by doing this on the ground. Otherwise, I find that doing it against the wall, so you're standing with your back up against the wall, and then what you do from there is you're just going to try to lift up your pelvis up while you're on the wall. So you can kind of feel your buttocks slide up and down on the wall as you're doing that exercise. So you can do this as a temporary relief thing by either lying, sitting, or standing and doing it just to get some kind of decompress the spine and make it feel better. Or you can try to incorporate it into your daily activities. So if walking, which walking is one of the most painful things for spinal stenosis. So if walking is painful, what you do then do is you would go into that posterior pelvic tilt, and it's difficult, but you can try to walk by holding that posterior pelvic tilt. So usually I have my clients, they go into that posterior pelvic tilt, and then you just kind of take small steps while doing that activity, like walking, for example. Okay, so give that a try. You would do that, like I said, temporary relief. The prescription really depends on the patient. You can do like 15 to 30 seconds. You can even do longer. Depends on how much relief you get from it. And then you would go from there. You would add that in. If it really works for you, you would do it more and more and more. Or if it doesn't really work for you and maybe you're not doing it correctly, then you would do it less. So it all depends on if it works for you, what your goals are, and you should really talk to a therapist in order to figure out the best option for you. All right, you guys, I hope this was really helpful. I hope this helps you figure out what you need to do for your lumbar spinal stenosis, either for short-term or long-term relief. If you are still experiencing back pain and you need extra help, or if this helped and you want extra help, I can help you fix your back pain. You can do that by either doing a couple things. Well, one, please like, comment, and subscribe. It helps the channel tremendously. And I'm going to keep providing this free content for you guys to help you solve your back pain so that you can solve your own back pain, but then share it to your friends and family and help everybody stay pain-free and avoid injections, medications, and unnecessary surgery. That's my goal here. So, but if you have back pain or you know somebody that has back pain, please share this video to them, and I will put a link down in the comments section in the description for my free ebook, as well as I have some other options down below. If you're a hiker, you're looking to train, go ahead, check out Hike Strong. That's my 60-day hiking program that will get you back on the trail and do your next adventure without experiencing back pain. There's a lot of training gear and a lot of rehab kind of material in there and prehab material in there, and you're not going to find that in any other hiking program. So go check that out. Otherwise, if you have back pain, you're looking for more help, please go ahead and either DM me, go ahead and fill out the form below for the total body diagnostic screen. We can exchange either emails or contact each other some way by filling out that form, and I will help you personally figure out what's the best thing for you to reduce your back pain. So as always, please like, comment, subscribe. I hope you like this. Share the video with anybody that may be interested in it and help them. It helps me tremendously. I'm going to keep making this content for you guys. I hope you really have a great day, and I'll see you on the next one. Peace.